Hello, my name is Rebecca Bentley. I'm the Nursing Professional Lead and Non-Medical Prescribing Lead at Bradford District Care Foundation Trust. The background to the pilot for the wound dressing scheme came from really improving the compliance to the wound care formulary. We wanted to also look at cost and reducing waste, so we established with NHS Supplies a relationship with them so we could build up a stock ordering basis rather than prescribing for district nursing and their dressings. The pilot has run out with 2 teams, which I know you'll be receiving information about with this filming. But we had lots of different reasons as to why we wanted to support district nurses approaching this in a new way, and that was around supporting GPs so they wouldn't need to do as many prescriptions, because we were finding that they were being asked where there were no non-medical prescribers to provide prescriptions for dressings for patients. So that was one area. We also wanted to support the district nurses who were non-medical prescribers. Obviously we don't have enough non-medical prescribers to provide one for every single team in the Bradford area. So there's a lot of pressure on the non-medical prescribers to do a lot of prescribing, assess and see a lot of patients. That was one element of it. We also find, looking at our EPAC data, that we do have some non-compliance with the wound care formulary, and by attaining compliance it means that we can make sure that we're using the best dressings in a cost-effective way, in a safe way, and providing top high quality for our patients. So that was another reason why we wanted to do this. And also we were finding that we had lots of waste when we were issuing prescriptions for dressings, because possibly they may come in packs of 12 and only a certain number were used, so we would have to throw some away. So there was some significant waste. So by looking at using this method and model of care, we're hoping to reduce waste, improve cost effectiveness and improve compliance with the wound care formulary.
My name's Darren Machin. I work for NHS Supply Chain. I'm an implementation coordinator, and I was asked to lead the pilot on behalf of Bradford District Care Trust and NHS Supply Chain to ensure it was a success. And the implementation process started in October 2015 with initial meetings with Bradford District Care Trust. We established the formulary, matched the formulary to provide MPC codes, which are product codes for the dressings. We then carried out site surveys for Windhill and The Ridge, the 2 pilot sites, and introduced ourselves to the district nursing teams there, who have been really helpful. We went on to set up 2 sites, 2 rec points which are delivery locations for NHS Supply Chain to successfully deliver the products into the trust and get the products on the shelves. We masked all other items in the catalogue apart from the agreed formulary, so nothing else could be ordered, and we set that up on our NHS Supply Chain solo system, which the nurses are using to place the orders. The order process is basically using the NHS Supply Chain system to place an order via a favourites list. You sign into the system, place the order via a favourites list, which is a shopping list of dressings. You're unable to see any other dressing on there as they're all masked. Once that order's placed, it goes off for authorisation, so it's fully checked, and then once authorised, it's delivered within 48 hours of placing the order. NHS Supply Chain deliver on a Monday into the sites via a small delivery van. The delivery would arrive and be signed off and checked by the district nursing team and put away on the shelves. The orders are actually authorised by Airedale at the moment. We're currently looking into this, but everything is fully traceable and auditable. So no order goes through without being authorised. Each individual order input has a financial limit of £500 and that cannot be breached.
My name's Sue Stenning and I'm District Nurse Team Leader for the Clayton Ridge District Nursing Team. We have a caseload of over 650 patients currently, all of whom use varying dressing types, and different surgeries recommend different wound care products. The pilot site was started in October, and myself and the district nursing team at Windhill have been part of that pilot site for that time.
Yeah, my name's Rachel Bland-Hussain and I'm a community staff nurse. I found the pilot quite challenging at first, changing the way we work normally, coming in and getting the dressings and taking them out to the patients. It's also been a challenge engaging other team members to change their way of working. However, now we find that it's been a great benefit.
The benefit to the pilot mainly is the patient satisfaction, in that they're not waiting for dressings being delivered by chemists. Their dressing products are there in the home, either ready to use, or the nurses who are visiting are taking them with them. We're not wasting stock because they're not stockpiling dressings in patients' homes, whereas previously we were. So that was a lot of wastage, dressing-wise, because they couldn't be reused because they've obviously been prescribed to that patient, so we're not reusable to another one.
The benefits that I found to the pilot are we always have a stock of dressings. We're using the same dressings on each patient, whereas before, when we were doing it via the prescribing, there was all different dressings in everybody's house, and now we have a standardised ordering. Those are the benefits. We can come in the morning, we can take the dressings away with us, and they're always there. We don't have to wait for them being delivered from the chemist, so that saved quite a lot of time.
The main challenge has been having staff change the ways of working. Staff have been used to going to patients' homes and dressings been there or not been there because the chemist hadn't delivered, as we previously said. And now, particularly with agile working, staff are needing to come into the office first thing in the morning and collect dressings before they go out to visit patients, though that has recently changed because they've realised themselves that if they come into the office the day before, they've seen the work list, they can prepare the visits, they can come in and collect the products so they can go straight from home to visit those patients.
The main challenges have been engaging the other staff members to change the way of working, to making sure that dressings are being taken in, especially when the weekend comes, making sure that those dressings are going in ready for over the weekend. Mainly that's the main challenge really. Everything else that I've found has been a benefit really to the team.
I hope that the project will be a long-term success because I'm sure that there's been some cost savings along the way. Certainly from my point of view, I've not written as many prescriptions, and the ordering that we're doing currently has reduced. When we first started ordering direct from stores, we did place quite big orders, but now we've got our stock control more in order, then we have reduced savings, I'm sure. So I do hope, that it continues and other sites start to use it.
Yes, I do think the project could be a long-term success. It's taken us a couple of months to find our feet with the whole project, but now it's working really well, and I think going forward, I think it's really good in terms of patient satisfaction. Patients have told us that they do prefer us taking the dressings in, and I think it could be good and cost effective as well.
The support from NHS supply chain has been invaluable. There's always been someone at the end of the telephone if we've needed anybody. And we've also had Darren from NHS Supplies who's been out to visit sites very frequently and offers his support and guidance. So we've had lots of really good, valuable support.
I found support from NHS supply chain good. When we send an email, if we're having a problem, we get a reply pretty much straight away. We can contact them via telephone if we've any problems. Darren visits regular just to see how we're getting on and provide any further support. Yeah, it's been good.
I haven't personally been involved in ordering products, but I do have 3 members of staff who order regularly on a weekly basis, and the feedback I get from them now is that it has become much easier than it was initially because they've got more familiar with the process, so it just comes second nature now.
I found the ordering of the products quite easy. Initially, when you put your first order in, you do have to list all the stock that you want to order. However, after that, they reply to your favourites, so you just click on your favourites and the list is there and you can just order quite easily. Yeah, so it's good.